Hello, I am Dr. Saurabh Patwadan from Nandadeep Eye Hospital. In order to control the spread of coronavirus, I think it is important to change our habits. So let's see how we want to change our habits. First of all, take care of your personal hygiene. It is your responsibility not to spread any infection that you might be carrying, even if you are perfectly healthy at this time. So always wear mask, whatever mask is available to you. If you are an adult and then don't take any attendant with you, it is better to have as less attendants as possible with you. It is better to go alone in a public place or a hospital. Give proper history. So apart from the temperature check, it is important that you are honest with your history. If you had recent fever or any travel to other countries or contact with a infected person, it is important that you inform correctly to hospital. Also, always do hand rub or good hand wash before you enter any public place, particularly hospital, so your hands are completely clean. Keep social distancing. There is no need to hurry. It is better to wait rather than spreading diseases all around. So receptionists also will talk from a distance with the patient, and usually it is not needed to approach any hospital assistant at close distance. Most of the things can be done from a distance of more than 1 meter. Once one patient goes and finds his seat, then the second patient should come forward, talk with the receptionist from a distance. Whatever queries you have, you can ask them. All hospital assistants will also be wearing masks so as to spread less organisms around, and then you go and sit at a designated place. Even if you have to go somewhere, again you occupy the same seat so that you don't touch lot of seats around, so as to control the spread, and try to be as patient as possible. It is the hospital staff's duty to clean these different objects like these chairs, the railings, the doorknobs, to clean frequently so that they do not become a contact point for spread of infection. Again, avoid any confined space as far as possible. If you have to take a lift, then again inform the hospital assistant so that he cleans the lift properly before and after. Avoid touching railings, doorknobs as far as possible. If you touch, always clean your hands. You can always carry a hand sanitizer with you. In OPD, always only one patient should be there inside the OPD. The next patient should wait outside. Doctor, assistants and patients should maintain good distance between them of at least 1 meter. Once the examination is done, the assistant will tell the patient to go outside and wait and maintain social distancing. Then the doctor and assistant will clean the points of contact, the instrument, the handrest, slit lamp, table, wherever they feel the patient has touched. Doctor will change if required gloves or will do hand rub or hand wash again. It is important for doctor to take all these precautions, because if doctor gets infected because of any patient, the other patients are also at risk. The same is true with hospital assistants as well, so they have to take maximum precaution as far as possible. There is no need to hurry and bring the next patient. So once they are sure that everything is cleaned properly, the next patient should enter. The appointment should be as brief as possible and avoid unnecessary prolonged appointments. So the examination will be quick, and as far as possible doctor will try to avoid any close contact. It is important that patient wears mask properly. maintains his personal hygiene. Again, when they are at the pharmacy taking the prescription medication, also at the time of counseling, a proper distance has to be maintained. Here the patient has given prescription, kept it on table, the pharmacist has kept the medicines there and then asked the patient to collect the medicines. So the patient puts the money on table, collects the medicine and receipt and goes. The pharmacist will keep the money inside and then again do a good hand rub so as to avoid spreading the infection from even the notes and change to next patient, and again the same procedure is repeated for the next patient. Obviously it will require more time, but we all have to be very patient so as to reduce spread of infection. Again, if you want to sneeze or cough, it is better to sneeze in your upper sleeves so as to reduce the chances of hand soiling. So all these habits have to be now inculcated, and we have to make sure that we do not spread any infection around. So it is duty of not just hospital and other service people, it is duty of each and every citizen who is visiting these public places like hospital. So most important thing is regular hand rub and hand wash. Keep a small bottle of hand sanitizer with you and keep cleaning your hands whenever you are touching common objects. Always keep social distancing. There is no need to hurry. Keep distance between two individuals. It is hospital and staff's responsibility to clean all the surfaces frequently, and it is the patient's responsibility to make habits of good personal hygiene so that he doesn't spread the virus.